were a number of things we knew through the early design phase with the Productivity Commission. We knew that this scheme had to be about more than more money. It had to be a total system redesign. And I think for that reason, we knew we had to trial the scheme, that we couldn't just roll it out. And we also knew that each of the states, in terms of the existing disability systems, were different. And so we were actually starting from different spots in terms of trying to reach this ultimate goal. And so we wanted to have trial sites in every jurisdiction because we knew that each jurisdiction had different strengths on which we needed to build and different inherent weaknesses. So, for example, some of the states were much further along the path towards individualised funding than other states. Some jurisdictions had been more underfunded than others, and so were more in crisis. And so we knew that we needed this trial period, that we would need a number of years of trialling, and it's been absolutely essential that we have trialled the scheme. So what happened was that the Productivity Commission undertook their inquiry. That reported in the middle of 2011. And then government officials spent 2 years writing the legislation, having the legislation enacted, developing the rules. So we've got underneath the legislation there scheme rules that also operate, and then also establishing what was called the National Disability Insurance Transition Agency was the formal title, and starting to bring staff into that and getting an initial set of operating guidelines. And so when we started, we had an initial set of operating guidelines, but with an insurance scheme, you need the data in order to inform what you're going to do. And so there's a real chicken and egg. So we had to be operating the scheme, collecting the data to then inform the next phase of development. And within a relatively short period of time, 3 or 4 months, we knew that the process of doing assessments was taking too long. So we then started to look at existing government programs to see whether the eligibility criteria closely matched the eligibility criteria of the NDIS. And where we found that match, we then could almost pre-qualify people for the scheme. And so that started to save time. But we also realised very early that we needed to change the process of planning because when we designed the scheme, we said that we wanted people to focus on goals. It was really important that people had goals, and so they looked above the limits of their lives now to what it would look like to be have the prospect of becoming a full citizen and working with them and their families for that. So we wanted a vision of the future. But what we then discovered was that people were trying to cram too much into a planning process, and that the plan needed to be more a facilitation and an enabler, and sufficient to give people a funding package when they could go out and actualise the plan themselves, or with support depending on their level of disability and their needs. And so the planning process needed to be much more focused on a funding allocation and then giving people the tools that would enable them to get on that path of participation, and really beginning a lifetime journey with the agency in a partnership where we were investing in them and in a way that they wanted, which was driven by them, but had this ultimate goal of maximising independence and social and economic participation. And the other part that we realised was that initially people were coming in and just wanting to talk about funded supports. and we knew that was wrong. We had to embed the provision of what we term reasonable and necessary supports within the context of a life, and a life is about loving relationships and friendships and being part of community, as well as having those funded supports that are necessary. And so we had to change the planning process to start with a conversation about what a good quality life is rather than what supports do you need.